Infections are a major problem for people with CF. Because people with CF have very thick mucus in their lungs, it acts like a place where infections want to grow. And the body's natural defense to infection is to try to fight it off with white blood cells or inflammation. And inflammation over time can cause serious problems for people with CF. It damages the lung tissue, it leads to increased coughing and sputum production and pulmonary exacerbations. So there are many things that are in the pipeline right now to treat the infections, both that are common, that we've been seeing for years and years, like MRSA and Pseudomonas, methicillin-resistant Staph aureus and Pseudomonas aeruginosa, but there are also bugs that we are now recognizing are more important, like non-tuberculous mycobacteria, or NTM. So in the pipeline, there are drugs that are being developed currently for patients to enroll in clinical trials of anti-infectives like inhaled antibiotics against MRSA, inhaled antibiotics against Pseudomonas. There are also trials that are being done to determine if some of these drugs interact with each other in a negative way and make them less likely to work. It's very important for us to know this as more and more drugs are being given simultaneously for patients with CF. One of the really innovative approaches that's being used to tackle infections is actually a medicine we don't really think of as an antibiotic, and in fact it isn't an antibiotic. There's something called intravenous gallium, and it actually is similar to iron, and it's been shown in preclinical research to kill multi-drug resistant Pseudomonas. So later this year, we're actually going to be starting clinical trials in people with CF of IV gallium. It's very exciting. Anti-infectives and antibiotics are really important for the care of people with CF right now because, as I said earlier, they are part of this vicious cycle. Infections lead to inflammation, which leads to chronic lung damage, and we want to prevent that chronic lung damage. If we find better ways to treat infections or even prevent them from happening, we'll keep the lungs healthier for longer. If you're interested in learning more about anti-infectives or participating in a clinical trial of anti-infectives, you should definitely talk to your doctor, but you can also go to cff.org and look up the research development pipeline.